Thanks very much, Ceann Comhairle. Ceann Comhairle, I welcome the opportunity today to discuss nursing homes and care of older people with colleagues in the House. To begin, I want to acknowledge the RT Investigates programme that was broadcast on the 4th of June. This was a very hard-hitting and harrowing programme which highlighted a litany of poor care standards in 2 nursing homes, showing clear neglect and abuse of older people, namely the residents Portlaoise and Benneven Manor in Glasnevin, the 2 nursing homes. The welfare of both the residents and their families was obviously at the forefront of my concerns following the RT programme. I am very conscious of the impact this programme will have had on the residents, their families and the staff in the nursing homes featured in the broadcast. I am also conscious of the impact the programme will have had on the nursing home sector more generally. It is important to acknowledge the committed, compassionate and dedicated providers and care staff operating in nursing homes across the country. Watching the programme, like everyone else, I was shocked and deeply concerned at the level of non-compliance with care standards and evidence from the distressing footage that was aired. In a subsequent RT primetime programme broadcast this week, we also heard personal testimony from the family of Auden Guy, Paul Guy, his son, regarding the poor ongoing care that their father had been receiving in Benneven Manor, has been receiving in Benneven Manor. As Minister for Older People, I want to state categorically that poor care, mistreatment, neglect, or any other form of abuse of any person living in a long-term residential care centre is completely unacceptable. I expect the highest standards of care are upheld for every resident in every nursing home across the country, and anything less than this standard will simply not be tolerated. The distressing footage aired during the RT Investigate programme highlighted that serious issues of non-compliance with these nursing homes. As the National Independent Regulator of Nursing Homes in Ireland, I expect HIQA and the Office of the Chief Inspector to utilise all powers available to ensure rigorous oversight and accountability in nursing home care. I met with HIQA on Wednesday the 4th of June to discuss the regulatory activity in relation to nursing homes featured in the RT Investigates programme. At this meeting, HIQA's Chief Inspector confirmed their continuous intensive engagement with the 2 nursing homes in question and have committed to providing me with an update on their progress this week. I can assure the members of the House that I, Minister Carol McNeill and the Department of Health are continuing to monitor developments closely regarding both nursing homes. The welfare of residents and families will obviously remain our highest priority, and Minister Carol McNeill will be meeting with HIQA shortly. I have also formally requested that HIQA furnish me with a comprehensive overview report of all of the nursing homes in the MES group. The Chief Inspector has committed to providing an interim report by the end of this week, a full report by the end of next week, providing an overview of the regulatory history, including but not limited to regulatory compliance, escalating enforcement actions and any additional conditions of registration. HIQA have publicly acknowledged the importance of examining its process and methodology. It is essential that these are continually being looked at for ways to improve the inspection and regulation of nursing homes. And on Tuesday of this week, I had a very constructive engagement with representative bodies and stakeholders from the nursing home sector, with an immediate focus on delivering the highest quality of care to the residents of nursing homes in Ireland. I want to be very clear that every nursing home resident deserves and should expect the highest standard of care at all times. To achieve this, it is paramount that registered providers in nursing homes adequately support their staff. Having effective governance and management arrangements in place ensures that staff are equipped to deliver person-centred care to residents. And that includes training and staffing as well. I also want to advise members of the House that I met with the HSE Chief Social Worker and with the HSE staff and management from the 2 nursing regions where the 2 nursing homes are located yesterday. The HSE have confirmed that director nurses from both local community support teams have been on site in both nursing homes and are continuing to engage with them. A review of safeguarding concerns that have been raised in relation to 2 nursing homes is also ongoing. The HSE has also confirmed that it will be engaging with all the nursing homes in the MES group over the coming week. With Department of Health officials, I also met with the HSE senior staff and management of the 6 health regions yesterday. The engagement was constructive and centred on supporting residents and staff in community nursing home units, CNUs, across the country in delivering the highest quality of care. I want to turn now to adult safeguarding. I know there have been many calls since the RT Investigates primetime programme aired for the introduction of adult safeguarding legislation. I also know that many deputies have been calling for this legislation for much longer. I am already on record as stating that the introduction of safeguarding legislation for the health and social care sector is a priority for Minister Carol McNeill and I. The Department of Health, in collaboration with the Department of Children, Disability and Equality, is currently finalising an adult safeguarding policy for the health and social care sector. Our intention is to bring it to government before the summer recess. This policy being informed by research, stakeholder engagement and an extensive public consultation carried out last year. It has also been informed by the Law Reform Commission report from 2024 and a McElroy review of adult safeguarding in the HSE, which was also published last year. The policy will provide a framework for strengthening adult safeguarding structures, processes and supports right across our health and social care services, inclusive of the public, voluntary and private sectors. Importantly, it will commit to the introduction of safeguarding legislation in the sector and will set out at a high level proposed new legislative provisions. The Government has included a health adult safeguarding bill in its current legislative programme to facilitate this, and it is recognised that this will be an important further development in preventing and protecting vulnerable adults from abuse. We look forward to engaging with deputies on this important legislation over the coming period. However, I want to be clear, very clear. Legislation on its own cannot and will not address the failings in care we have witnessed in these 2 nursing homes. We must remember that we already have safeguarding requirements in legislation for nursing homes. The 2013 Care and Welfare Regulations contain specific requirements in relation to adult safeguarding, including the provider must have a safeguarding policy, must take all reasonable measures to protect residents from abuse. All incidents or allegations of abuse must be investigated by the person in charge and notified the Chief Inspector and records kept. Staff must be trained in relation to the detection and prevention of and response to abuse. We also have the National Standards of Safeguarding, which were developed jointly by HICWA and the Mental Health Commission. And this is not to say that we don't need further legislation provisions, and we will be bringing this legislation forward as a matter of priority. However, the distressing images we saw in the RT Investigates and primetime programme demands a more fundamental change in culture, one of which poor care, poor practice, abusive and inappropriate behaviour are not tolerated. One in which staff feel empowered and supported to call out poor practice and know exactly how to do this. The forthcoming policy on adult safeguarding for the sector will not only provide the framework for legislative change, but will also for a wide-ranging reform programme across our sector to ensure that a culture of safeguarding and a culture of intolerance for poor care is fostered and embedded at all levels. Safeguarding in its widest interpretation is about safe services. We all have a fundamental right to feel safe, more especially in the case of residents in nursing homes, in what is their home. As Minister with responsibility for older people, I remain fully committed, working with Minister Carol McNeill to introduce this robust national policy on adult safeguarding for the health and social care sector, strengthening Ireland's existing legal, policy and operational safeguarding framework, and driving necessary reforms to enhance protections within the health and social care sector. Although engagement with our older population clearly indicates their preference to age in place in their own homes for as long as possible, it is recognised that care provided in long-term residential care settings will continue to be an important part of the continuum of care for older people into the future. Across the country, nursing homes in the public, private and voluntary sector play a vital role in the provision of long-term care and other services. And I suppose it is acknowledged that the nursing home care sector has evolved in Ireland over the last 30 years, from a predominantly state-led service to a situation today where approximately 80% of nursing home services are provided by the private sector. I'm fully aware of the investment trends in the Irish long-term residential care market, the growing consolidation of the sector, and the complex investment and ownership structures that now exist. It is therefore important that all aspects of the nursing home sector are scrutinised over the coming period to ensure that service delivery and configuration meet the need of service users in a sustainable and safe manner. For those people who require long-term residential care, it is imperative that we ensure that they have access to safe, high-quality and regulated care service in a timely manner. To avail this care, most people do so through the Nursing Home Support Scheme, which is commonly known as Fair Deal. Fair Deal was designed to protect and support vulnerable older people, to give them a home and to ensure equal access to nursing home care. It has given people the opportunity to live in a safe environment in a sector that holds to the highest standard of care. For those who avail of long-term residential care, it is critical that the high standard of care continues to provide in settings that can meet their needs. The Fair Deal scheme will receive government funding in excess of €1.2 billion this year. The government is also committed to continued investment in healthcare infrastructure which supports the highest quality care for our older population, and to utilise planning and resource allocation measures as a lever to reduce regional inequalities in long-term residential care supply. The investment includes the ongoing community nursing unit programme, a major capital infrastructure programme which was launched to ensure that up to 90 of our public community nursing beds in community hospitals will be refurbished or replaced to ensure the best quality environments for our older people and to meet HIQA standards. €4 million was allocated in Budget 25 to staff and open 615 public community beds this year in capital projects that are coming to fruition through this programme. And the programme for government commits to building more public nursing home beds, and this is an absolute priority for the government and for me and Minister Carol McNeill. The Department of Health, alongside the HSE, is currently developing a new public long-term residential care additional capacity plan which will be published in 25, and as I've already stated, public beds, nursing home beds, are a priority for government. This plan will be informed by an updated 2018 healthcare capacity review currently being undertaken by the National Social Research Institute, which will identify future capacity needs in the sector. The ERSI report on older people's care will be published this month. It is also of paramount importance that the built environment and location of long-term residential care setting supports high quality and positive experience for our older population. The Department of Health therefore committed to creating new design standards for long-term residential care settings for older people across all sectors. The aim of the design guide is to describe and illustrate what good building design looks like for long-term residential care settings for older people, and to provide a common benchmark against which the standard of these settings can be measured. In December 2023, a public consultation on the draft design guide for long-term residential care settings for older people was launched, and a report on the public consultation reflecting the feedback received was published in January 2025. This is a matter I am working on with my department officials to progress as quickly as possible. And earlier this year, I launched the Nursing Home Residential Premises Upgrade Scheme. This is a €10 million scheme that will support nursing homes to carry out structural works to improve compliance with standards published by HIQA under Regulation 17, which concerns the nursing home premises itself. The maximum can pay in the individual nursing home under the scheme is €25,000. And I am aware that while our commitments and programme for government are ambitious and achievable, the scale of the demographic challenge ahead is significant. In this context, in March of 2024, the government established an independent commission on care for older people. The Commission is charged with examining the provision of health and social care services and supports for older people, and with making recommendations to the Government for their strategic development. Subsequently, a cross-departmental group will be established under the auspices of the Commission to consider whether the supports for positive ageing across the life course are fit for purpose, and to develop a costed implementation of options to optimise and implement these supports. The Commission on Care is due to publish its first report shortly. The Programme for Government 2025 pledges to publish, resource and implement a national action plan that will take account of the work of the Commission of Care to ensure that long-term care is timely, comprehensive and affordable, and examine and enhance the mix of professional care options, including home care, community-based care, independent living options and long-term residential care facilities. As all members of this House will be aware, the Irish population is growing across all regions and age groups, with the most significant growth seen in the older age groups. The number of people aged 65 and over is estimated to have risen by over 40% between 2013 and 2023, and it is expected to double again to 1.6 million by 2051. In 2020, it was also estimated there was approximately 64,000 people living with dementia in Ireland, and the number is expected to rise to 150,000 by 2045. The improved health outcomes and extended life expectancy that have been achieved in recent decades must be acknowledged and celebrated. We all clearly recognise the benefits that our older population offers to society. Ageing population, however, will present healthcare, social and economic challenges in the coming decades. Thoughtful preparation, combining policy and institutional reforms, investment in capital infrastructure and technology innovation can enable this country to meet this challenge and take advantage of the real opportunities presented by the demographic change. Investing in service for older people has been a governmental priority over recent years, with an increase of approximately €1 billion in funding for services for older people since 2020. This year alone has seen an increase of approximately €250 million, and the amount secured under Budget 2024, bringing the total figure to almost €3 billion in Budget 2025. Sláinte Care is the most significant and reform programme in Ireland's health sector, and Sláinte Care reforms are changing how health and social care services are provided. Sláinte Care is focused on providing the right care in the right place and at the right time. Instead of relying on hospitals as the primary location of care, to focus on providing more care in the community or at home. This is also accompanied by a strong emphasis on prevention, which will help people stay healthier for longer and reduce the number of people who would otherwise need medical care in an acute setting. The recently published Sláinte Care 25 Plus plan sets out an integrated and whole-of-system reform programme to be implemented over the period 2025-2027 and is designed to respond to demographic challenges that Ireland is facing. The plan builds on the progress made in implementing successive programmes for government Sláinte Care implementation strategies between 2018 and 2024. It is an ambitious and multifaceted programme designed to move Ireland towards universal healthcare service. The 2025 programme of government is dedicated, amongst other things, to the vision of creating a caring society. It commits to a range of actions that will advance a societal care model which supports older people to live full and independent lives in their own homes and communities with the appropriate wraparound supports. It is incumbent upon all of us to work collaboratively to realise this vision. Home support is an essential service for thousands of people each day across the country. It is highly valued by service users and families. Since 2020, the Government has increased the budget for home supports by over 70%, from €487 million to €138 million in Budget 2025. Delivery of home support hours is increasing year on year and will continue to do so as demand is expected to increase due to an ageing demographic and older people's wish to stay at home for as long as possible. The programme of government commits to design a statutory home care scheme, which is an absolute key priority for me as Minister for Older People. In the time I've been in this post, this is something I really want to progress. And the Department of Health is progressing development of a regulatory framework for providers of home care support services to support this commitment. The new system of regulation for home support shows that the public can be confident that the service provided are of a high standard and bring Ireland in line with the best international practice. The legislation that is being developed will regulate home support services in Ireland by establishing a system for registered providers of these services, which will be an offence to operate a service without being registered. Alongside this, HICWA is currently finalising draft National Quality Centre submission to the Minister. First step we must do in statutory home care is to bring in legislation to regulate home care providers. We then need to define what statutory home care is, and then we need to look at a funding model. And this is something I'm absolutely committed on, but the first step is the legislation for home care providers. The programme for government has a strong focus on community supports for older people, including day centres and Meals on Wheels. Day centres are a crucial part of social care provision in our communities, providing invaluable support for people who, for any number of reasons, be experiencing isolation and loneliness. Currently, daycare services are provided across the country by private voluntary HSE-funded daycare centres. Since its establishment, the Meals on Wheels service has also been an invaluable resource in helping older people in our communities to maintain their health and independence through the provision of healthy meals. In line with Sláinte Care priorities, the Enhanced Community Care Programme is a major reform programme. The objective of the programme is to deliver increased level of health care with service delivery reorientated towards general practice, primary care and community-based services. The focus is on implementing end-to-end care pathways that will care for people at home and over time prevent referrals and admissions to acute hospital where it is safe and appropriate to do so, enabling a home-first approach. As part of the Enhanced Community Care Programme, the Integrated Care Programme for Older People model aims to improve the quality of care for older people, providing access to integrated care and supports that is planned around their needs and choices. These interventions support older people to live well in their own homes and communities without the need to access acute care settings. The Integrated Care Programmes for Older Persons seeks to ensure that older people with complex care needs can access care quickly, or at or near home, through care pathways specifically designed for older people and target fragility, fall prevention and dementia. The Department of Health and HSE also supports a number of complementary support coordination models which help our older population to age in place for as long as possible and reduce the rate of older people transferring to long-term residential care. The Healthy Age Friendly Home Programme is an innovative partnership between the local government sector through Age Friendly Ireland and Sláinte Care. Both commenced in 2021, saw the introduction of new person-centred robust support coordination service that will enable older people to continue living in their homes or in a home more suited to their needs, and will help older people to live with a sense of independence, autonomy and feel part of their communities. The HSE is also partnering with Alone as part of the rollout of an enhanced community care programme to develop a support coordination service. The focus of this service is to support older people live independently at home for as long as possible by facilitating access to services including befriending, social prescribing, assistive technologies and by coordinating linkages to local community groups. These services support enhanced community care model and facilitate the HSE to deliver a coordinated system of care integrated around older persons' needs. The programme for Government 25 also commits to a new all-of-government national housing plan to follow Housing for All, and in my dual role as Minister for Older People and Housing, I'm committed to a particular focus on housing options and choices for our older population in the context of the new housing plan. It is absolutely vital that we continue to increase the housing options and choice available to older people and facilitate the integration of supports in a more coherent way between the housing and health sectors. To this end, the Department of Health and the HSE, alongside the Department of Housing, Health, Local Government and Heritage, are currently supporting a Housing with Supports demonstratory project in Inchicore and Dublin. This is a collaborative cross-sectoral and cross-departmental that recognise the need for a joined-up approach to addressing the critical issues of creating housing choices for our ageing population, enabling people with lower care needs to live independently for longer. It is the hope that this project will act as a pathfinder project for the future mainstreaming of this form of housing. I was pleased that the Innovation Housing Project reached a significant milestone recently, with the first tenants receiving the keys to their new homes. As I have already stated, an ageing population means the prevalence of dementia is increasing. I am committed to improving services for people with dementia and their families, and just over 2 years ago, in May 2023, the HSE published its new model of care for dementia. The model of care sets out care pathways to advance timely diagnostic and post-diagnostic support and care for people living with dementia in Ireland, and sets target to achieve this goal. To support the implementation of this model of care, the Government has funded new special diagnostic memory services in locations around the country. Establishing these essential services will ensure that there is a timely access to both diagnostic and post-diagnostic supports and reduction in waiting times. There has also been 19 million in new recurring investment in dementia services for the past 5 budgets, and the Government is committed to continue to invest in improving services for people with dementia. This government has also made significant commitments to improving dementia service in the 25 programme for government. And since my appointment as Minister for Older People, I've been working in earnest towards this implementation. And in May, I was pleased to announce the implementation of one of the programme for government commits to the development of a national dementia register for Ireland. The National Dementia Register will provide us with vital data on many aspects of the care of people with dementia, and this is something that people, representative and more people with dementia, it was a top priority for them, and I'm pleased that we've been able to initiate that creation of that register, which will be hugely beneficial in addressing the needs of people with dementia. The government will continue to build on the already substantive investment in dementia over the next 5 years. And to conclude, I want to state my absolute focus over the life of this government will be on ensuring that Ireland can genuinely call itself a great country in which to grow old. And as Minister for Older People, I want to ensure that our older population feel valued and respected. And when health or social care services are required, that our older citizens receive the absolute best possible care, whether in their own homes and communities or in long-term residential settings. I also want to firmly reiterate that poor care, mistreatment or any other form of abuse of any person living in long-term residential care centres is wholly unacceptable and will not be tolerated. Every resident of a nursing home deserves dignity, respect and the highest standards of care. And as Minister for Older People, I and Minister Carol McNeill and the Government are absolutely committed to ensuring that everything possible is done to ensure the distressing scenes we witnessed in the recent RT Investigate programmes do not happen again in any nursing home across the country. We saw clear neglect, clear abuse, violations of basic human rights for older people. And I want to restate and be very clear that every nursing home resident deserves and should expect the highest standard of possible care. I can't repeat that enough. When this issue broke, and like everyone else, I watched the programme. My immediate thing was the wanton neglect, was to reassure older people to deal with the issue for the older people in the two nursing homes, the residents and Ben Nevin Manor. So I rang Bernard Glasgow after the programme was aired to ask that the HSE would put in safeguarding teams and direct our nursing into the two nursing homes. I had met HICWA earlier in the day. It had been broken by RTU what the name of the two nursing homes were, so I immediately had a meeting to look for that they would continue with intensive engagement. They would provide a report by the end of this week, an interim report on the MAS group overall, and a final report next week. I had follow-up meetings with the nursing home sector to ensure that they were reaching out to their members to provide in terms of the provision of safe care through nursing homes. I then met with the HSE and their community nursing home units that they would do likewise in terms of reaching out to nursing homes, reaching out to residents, in terms of what's happening as we speak. I met with the HSE safeguarding teams. They met with the directors of nursing, had meetings with them yesterday in terms of their interaction. What happened should not have happened. It was identified in the HICWA reports, two reports, the issues in Portlaoise. The Ben Nevin report did not highlight that fact. These are questions I put to HICWA. How did this happen? And furthermore, why were the compliance plans not implemented? This is basic in terms of process. And like everyone else, I have only one concern above everything else, politics aside. I'm at this 20 years. The care of older people. What we witnessed in the two nursing homes was unforgivable. No one should be treated in that way. And what we have to do now is we have to, whatever is required here, we have to get a system where we provide reassurance to residents and their families in terms of delivery of safe healthcare, the length and breadth of Ireland. And we all know there are nursing homes out there delivering great care. There are great staff delivering great care. But once again, I go back to the key thing. The older person in a nursing home, they must be respected and dealt with And what we saw on the programme in the RT Investigates, and I commend them on the work, was of a magnitude that it can never ever happen again in terms of neglect and abuse of those older people. And I certainly, in my role as Minister, working with my colleague Minister Carol McNeill and Government, will be working night and day to ensure this is rectified and this never ever happens again. Thank you.
Thank you, Minister. We're on to the Sinn Féin Party. Deputy Newsom-Drennan, you have 10 minutes.
Last week we witnessed highly distressing scenes of neglect and abuse at two MEs operated nursing homes in Dublin and Portlaoise, scenes that government have long assured us were consigned to history. First and foremost, my thoughts are with the individuals and families affected. I'm hoping that counselling and health service have been made available immediately to them, and if not, then Minister must ensure that this is done today. I also want to commend Claire Doyle and the various whistleblowers who contribute to the unearthing of the abuse of the nursing homes. Her words were exceptionally powerful and deserved repeating. She described what she saw as one of those dreams when you are in a situation when something awful is happening and you are screaming into abyss. That's what it felt like. That's how desperate I was, because I knew the real human suffering that was happening. These are our parents, our aunts and our uncles. As a professional, I was shocked, I was ashamed, I was angry. As a human being, I was heartbroken. These revelations of systematic institutional abuse at residential home care come 20 years after Leeds Cross and 10 years after Oireachtas. In the intervening years, we have had scandal after scandal which have underlined the inadequacy of existing legislation, the major gap in law in the absence of Adult Safeguarding Act, and insignificant resourcing and empowerment of safeguarding teams. MEs is the largest nursing home operator in the state. In the last few years, they have expanded more than 2,400 nursing home beds across the state. Astonishingly, the government have allowed this to happen, despite revelations of widespread abuse at their centres in France. HIQA has inspected multiple MEs-run homes, and they have identified repeated non-compliance across the reports. Malnutrition was a feature echoed across the report, and the RTE documentary clearly identified not only understaffing but gross misconduct and total disregard for individual care plans. The staff were not being governed properly, and poor practice was clearly routine. Poor practice seems to be the standard that was expected and encouraged. The residence in Portlaoise is just one example of how MEs runs its nursing homes in Ireland. The residence has been inspected on multiple occasions by HIQA, and on no measure in the latest report were they found to be fully compliant with regular standards. Not only non-compliant, but repeatedly non-compliant, with little evidence of even trying to improve their standards. HIQA found that the provider had failed to implement the compliance plans submitted following previous inspections, and that the overall governance and management of the centre had deteriorated since the last inspection. Most worryingly, staff were unaware that a resident at high risk of malnutrition had been reviewed by a dietitian in January, and as a result, interventions to manage nutritional risks were not completed. In layman's terms, people at the home are suffering from starvation, and neither management nor the owners seem to care or even inform staff of changes to care plans. Malnutrition to an ordinary person is a major red flag. Food is a basic requirement for survival. Without that, what hope have you got? Yet what happened to stop this? It seems nothing. No financial penalties or no closures. The RTE documentary made clear that care plans were not being used appropriately, if at all, and certainly were not being referenced when decisions were made on staffing and resourcing. HIQA found repeated failures to ensure that staff were appropriately trained and supervised, and that records were not being managed in line with regulations. They even found that records relating to family complaints were not being documented. RTE revealed that MEs was plamassing families with tales that they would improve services, but nothing was changing, nothing in practice. I am particularly taken by this quote from the CEO of Emmys. "Our jobs are profoundly human. Each of our gestures, each of our actions has a direct impact on residents." And what were those impacts? Bed sores, bruises, calls for help going unanswered, starvation, deprivation of liberty, a lack of dignity, a lack of respect and a lack of care. How is it that that operator got away with it? Is it because the operator knows how to play the system to make sure that there are enough staff around when there are inspectors or visitors, which is cut to skeleton crew when nobody's watching? They seem to know what to say, when to say it, but do something entirely different when they think no one is watching. The problem at the heart of all of this is privatisation and the consolidation of nursing home care in large multinational for-profit corporations. Over the last few decades, Fianna Fáil and Fine Gael have gutted the public residential care sector in favour of private homes. More than 80% of residential care for older people is now provided by the private sector, and this is rising every day. That is not a criticism of private nursing homes. There are many fantastic local centres run by honest people who provide top quality care. There are many fantastic nursing homes around the country, but there are far too many homes which are run like prisons, maximising profit instead of making sure that they meet people's needs. To even call what we saw last week prison-like conditions does these residents any injustice. These conditions are worse than prison and a total deprivation of liberty. These are supposed to be people's homes, but what we saw was anything but a home, and it could be any one of our loved ones suffering from it. Your first job as Minister responsible for older people is to get safeguarding legislation done. Your government has been prioritising this for years but has done nothing. This legislation must establish an independent safeguarding authority with real powers and resources to act on individual clinical concerns. There must be mandatory reporting of concerns of abuse and neglect. HSE safeguarding teams should be brought under the remit of this authority, and they need to be significantly expanded to do their job. Safeguarding teams and social workers must be given a legal right of entry and permitted to investigate concerns unannounced at any time. And where management and corporation leadership make decisions which lead to poor quality care and the loss of health of life of residents in the care of services they are responsible for, there must be accountability. There has to be accountability at an organisation level, not only at staff level, but there are failures to govern safely, such as those identified in the RTE Investigates reports. There must be a step change in investment in public nursing home capacity to reverse our over-reliance on the private sector. You must also engage with smaller operators and community homes to see what they need to stay viable in an increasing complex sector. Care for older people and for you and me as we age is in need of radical change. You should review the mandate of the Commission on Care and ensure it can future-proof the model of care for ageing. And you must develop a comprehensive social care policy to support independent living. Sinn Féin has proposed a home-first approach to care, backed by a statutory home care scheme that forces the system to redirect resources to home care. It is essential that you get the statutory home care legislation right and that the current bill before the House does not go anywhere near far enough. Home care must be prioritised, and this will have profound implications for the nursing home sector as the complex of people's needs will rise. We must be empowering people to live full independent lives, not only adding years to life but adding life to years. Last week, the Taoiseach defended the existing regulatory system. He said that there are already laws in place to deal with this. Those laws are clearly not working. And everyone has been telling you for nearly 20 years that they are not enough. Minister, in my previous role, I was a carer for 18 years. And for 18 years, we give the best of care. There is people that are set out for these jobs. Not everybody is made for them. But what I've read in the reports, in my previous role when inspectors came in, there was 2 of them. For 2 days, we had 3 residents, we had care packs. It takes a long time to go through them. I would have had 100% faith in them until now, until I read those reports. I've read the 4 reports. 1 person, 1 day for 24. The last report, 2 days, 2 people for 2 days for 70 patients. That is not enough.
Thank you, Deputy. Deputy Carty, 5 minutes.
Older people, indeed all of our vulnerable citizens, deserve to be treated with dignity and to be afforded the highest quality of care and the services that they need. What we saw, though, in the revelations in the RT Primetime Investigates programme were actually appalling, showing shocking abuse and serious failures and neglect. I can only imagine how upsetting it was for the families of the people who were revealed to them in that programme, to others who had family members resident in those homes, but indeed to anybody who had a relation in a nursing home, to see such abuse and mistreatment. Essentially what we saw was vulnerable people left without basic care, as the homes had an inadequate supply of basic items: bed sheets, towels, sanitary wipes, gloves. Others we saw quite disgracefully being roughly handled. We know that the company at the centre of these revelations, Emmy's Nursing Homes, bears primary responsibility for what was exposed in the investigation. Emmy's, of course, has to be held to account for how these vulnerable people were mistreated. But we also have to deal with fundamental failures and the abuse that were exposed, and recognise that government policy over the recent decades has played a role in all of this. This is not the first scandal in an Irish nursing home. Indeed, much of the commentary has been made of the fact that 20 years ago the Lees Cross scandal led to the establishment of HIQA. And I heard what the Minister has said, that politics aside, and I accept that all members of all parties will be equally disgusted. But surely, Minister, when you were reflecting on the programme, you reflected on what was a very specific, determined and protracted policy of privatisation of our nursing home care, and the privatisation of the care of the most vulnerable citizens, whether that be elder care, home care or health care, is wrong, and it doesn't work. And the provision of such a role should be one that the state takes a leadership role in it. And I heard what the Minister has said about older people in nursing homes need to be treated with respect. Absolutely. And the first stage and the first step in treating our elderly with respect is to stop treating them as a commodity. And that's when you privatise, and when you and particularly when you commercialise the provision of care, well, then a profit motive is introduced. And serious questions have to be asked. We know the move away from the public nursing home model has had a profound impact. But we also know that there are local family-run nursing homes that are telling us that they can't financially survive. And has anybody asked the question, well, if they can't financially survive, how is it that these multinational institutions are able to come into Ireland and operate at such a large scale and not only survive but be financially profitable? It's very clear that corners have and are being cut. And we have to recognise that when you privatise a service, then you have a race to the bottom. We have people who are caring for the most vulnerable people in society who are on the minimum wage. People who are portrayed in that programme on the minimum wage. Essentially, you have people who have a really invaluable role in our society, caring for our elderly or other vulnerable citizens who are earning the same wage as a teenager on a summer job in a meat factory. There's something profoundly wrong with that situation, and we can't point to others without recognising the political decisions led to that scenario. So we have to move away from the privatisation and commercialisation of our healthcare system in the round, and we need to start with the provision of care for those people who have contributed all their lives to our society, to our elderly members of our community. And I hear what the Minister has said in terms of the prioritisation of home care, and I agree. I agree, absolutely. Every person I know wants to grow old in their own home if that is at all possible. But I'm sure the Minister also knows that there are families the length and breadth of this state that want to do that for their families. And what do they meet from the state? Obstacles. If they want to care for their loved one themselves, they're assessed as to whether or not they can get some support on the basis of somebody else's income. Your parties made a commitment that for the abolition of the carers allowance, but we haven't heard a single word about that since the general election. And then we have the situation where those people who need home help hours can't get them. And what's happening within the home help system as well over the past 2 decades? Privatisation, commercial companies providing a service that the state should be providing. I really, really hope that members of government parties will reflect on the decisions that were made over the past number of decades and ensure that we actually have the sea change that is required to ensure that we will never again see scandals such as this.
Thank you, Deputy. Deputy Ellis, 5 minutes.
We all want the best for our elderly relatives when it comes to their care in the latter part of their lives. They paid their taxes and contributed to the growth and prosperity of the country. So the least that they deserve is that they can have a life without worry or stress in the twilight of their years. Some parents are cared for by family members in their own home or in the home of their adult children. Where this is not possible, such care is provided in nursing homes. While many elderly people can thrive in a nursing home and live a second life, the move to such a facility can be traumatic for others. The care home will understand this, and a good care home will ensure that this transition from a family home to a nursing home will be done with sensitivity and the greatest of care. An elderly person in the care of a good nursing home will have a positive impact on the well-being and mental health of the elderly person, as well as the family members who are unable to provide care in the home for their elderly relative. They can be assured that their parent will receive 24/7 care with daily living, receiving assistance with personal care, eating, mobility, as well as medical care and supervision. They offer peace of mind to families that their elderly relative is being cared for in a safe and supportive environment, allowing them to live as independently as possible while receiving expert nursing care, rehabilitation and providing a range of social activities to promote engagement and social interaction, including outings, entertainments and hobbies. It will have trained nurses providing specialised care, including wound care, administration, medications and managing chronic conditions. It should also provide rehabilitation programmes to help residents improve mobility. A priority of nursing homes is to provide a safe and secure environment for the elderly resident. Ireland has a growing elderly population, so nursing homes are a crucial part of the healthcare system by providing long-term care for those who need it. However, when any part of this falls down, then the impact on the elderly resident will be traumatic for the resident and for their families. Unfortunately, as we have seen from the recent RTE investigation into nursing homes, and in particular Benevan Manor in my constituency of Dublin North West, the quality of care is not the same in every nursing home, and the RTE report has raised important questions as to the adequacy of care received in this particular nursing home. It is clear from the investigation that care in Benevan Manor has failed in the provision of a quality service to residents and raised serious questions as to whether residents' needs are being properly met. A big problem with private nursing homes is the high turnover of staff, which can also impact the staff to resident ratio. Staff can be overworked, and if the nursing home is understaffed, then it will struggle to provide personalised care, which in itself can result in inadequate care for the resident. A 2021 study found that there was an average turnover rate of nursing home staff of 27%. However, private and voluntary nursing homes have experienced even higher turnover rates, with 38% for nurses and 54% for healthcare assistants. The reasons for this high turnover of staff are many and include low pay in the sector, poor training opportunities, lack of personal development or career progression, and very challenging work-life balance in the sector. These factors impact on staff morale, as well as being and will have a knock-on effect of impacting on the care for the elderly resident. What factors contributed to the scandalous care of one particular resident in Benevan Manor, whose story featured in the RTE investigation, are laid out in the HICWA report into the nursing home. The report raised concerns around the provision of care in the home and its risk management. The report also highlighted in particular the need to address issues relating to record management systems, to address related issues to record management, such as contracts for services, food and nutrition, resident protection, information for residents, infection control and the use of restrictive practices. Our vulnerable elderly citizens need to be protected. Over the years, we've had too many nursing home scandals. It is also scandalous that we are still waiting for the enactment of the Adult Safeguarding Bill 2024, which will also establish the National Adult Safeguarding Authority. This bill and this new authority will help safeguard adults at risk of harm and abuse, providing mechanisms for reporting incidents and protecting the rights of adults in vulnerable situations. We cannot rely on HICWA. There needs to be a mandatory reporting of abuse and a legal right to entry for social care teams to investigate complaints. Our elderly citizens need to be protected, and families need to know that their elderly relatives are receiving the care and respect they deserve in their latter years.
Thank you. Thank you, Deputy. Deputy O'Reilly, 5 minutes.
Minister, the Sunday Independent in 2004 reported on a nursing home known as the Ross Trevor nursing home. It was based in Rathgar. They had obtained a report that was dated August 2000. That report describes the facility as being dirty and grubby throughout. They reference an elderly man being fed his meals on a commode. Further inspections revealed that the Health Board recommendations were not implemented. A frail elderly man was found cold and unkempt. The report said that there was little evidence of continence wear provision for clients. Continence wear, just the indignity of it, it's hard to believe. 4 months later, in 2001, they found ongoing breaches of nursing home regulations. The South Western Health Board subsequently said that the threat of revocation of the licence was not pursued in 2001 as the issues were addressed, but nothing improved, Minister, because in August 2004, the Health Board sought an injunction from the High Court to have the home closed. The owner, Theresa Lipsett, was fined, but the nursing home stayed open. Now, bear in mind, Micheál Martin, the famous learner of all the lessons, he was the Health Minister at the time and throughout this. Fast forward to 2011, Fine Gael are in government with the Labour Party. HICWA brings the HSE into the same nursing home, Minister, so all the lessons that were supposed to be learned weren't. The Irish Mail used the phrase at the time, House of Horrors, to describe the conditions. Nothing had changed. Now, that nursing home was closed down in 2011, and I was asked to go there to give some advice to the workers because I was representing healthcare workers at the time. They were migrant workers. They were absolutely petrified. The residents had been taken off. They were the whistleblowers, and they were left completely abandoned. But Jesus Christ, Minister, when they described to me how they were told to behave, how they were instructed, the instructions came from the top, and that's what happens, and that is why we are here to look to you as the government to show some leadership on this. The first time Ross Trevor and the Lipsetts came, these are the owners, came to public attention was before Lees Cross. The second time was 6 years after Lees Cross. The latest Primetime Investigates programme is 20 years post Lees Cross, and yet we see that very little is changing. The state just gives these lucrative contracts to unvetted providers for emergency accommodation, for the provision of services for international protection applicants. You are making millionaires off the back of human misery and indignity and poor treatment of our older people and vulnerable people. And you have been warned. It's not just the opposition saying this. The ESRI told you very, very clearly. Brendan Walsh said, Ireland is at an important juncture in establishing a sustainable long-term care system for older people. The pandemic had an impact on long-term residential care and workers, but this period also saw large changes in supply, ownership and financing of the sector, and the sector faces a number of challenges as it emerges from the pandemic. The system is increasingly reliant on a small number of profit-driven operators, and that is the problem. It is the small number of people trying to make a profit off the withholding of incontinence wear from old people. Just the indignity of it, Minister. They are making money. That's where they're cutting the corners. They're cutting the corners on incontinence wear. And they're cutting the corners on staff. They're cutting the corners on food. They're cutting the corners because they are chasing profits. And your government is facilitating it. As I said, when the Ross Trevor nursing home revelations shocked everyone, when they came to light, Micheál Martin was the Minister for Health. He's the Taoiseach now. There is an unbroken pattern here. Fianna Fáil and Fine Gael have your hands and your fingerprints all over this, because it is your policy. And what we saw in that primetime programme, and I'll be honest with you, Minister, I couldn't watch all of it. I couldn't. I had to look away for some of it because it is heartbreaking. But what is the most heartbreaking of all is that this is not new. This is not news. This didn't just happen. This has been happening for decades. So, Minister, I hope that you are true to your word today. When you say that you are serious about tackling this issue, I hope that you do that, but you will be measured, and your legacy will be measured against how elderly people are treated. You should give them a choice, Minister, and you know that. People should have a reasonable choice to stay at home if that's what they want to do, but you don't give them a choice. You force them into nursing homes, and we see how they are treated. So, Minister, your words are one thing, your actions will tell a lot. Gormagat.
Deputy Sherlock.
Minister, I suppose I want to welcome that we're having this debate here today, but we shouldn't be here. The RT, huge credit to the RT Primetime Investigates team for putting together that programme. But of course, if HICWA had been doing their job, we wouldn't have had to have that programme. Claire Doyle shouldn't have had to take that enormous step on her part to effectively tell the story of the stories that have been relayed to her. And indeed, I would argue, Minister, that we need to hear more from her, because I believe she has more to say. And to the Guy family in Glasnevin, and indeed to the other families of the residents in both Portlaoise and Glasnevin, I'm extremely conscious, and I think we all are, that one of the most difficult decisions any family will ever take is to put a loved one into a nursing home. It's a decision that places enormous trust in strangers to treat that person with dignity and respect in their final years. And we have seen a fundamental breach of that trust. My very serious concern, as I said earlier in the Dáil today, is that when all this dies down, the only focus for government is going to be ensuring that HICWA tries a bit harder, gets its act together, and that we have the adult safeguarding legislation. Now, I'm saying that separate now to the work on home care supports, because that's a very important body of work that needs to happen. But we will always need nursing homes in this country. And indeed, if the figures prove correct, where we're going to have almost more than 500,000 people over the age of 80 in 25 years' time, and people living in rented accommodation, or in my constituency, 3 generations living to a home, we're going to need nursing homes, and we have to get it right. And I suppose the one thing that really strikes me, Minister, when I've been thinking about this over the last number of days, there's 2 things. Firstly, the raft of reports that are sitting in your department gathering dust. We have a report from 2022 on workforce planning. We have the pilot on staffing. We have the learnings from COVID from 2020. We have the guidelines from the start of this year on the maximum size of nursing home beds. And what has happened? But each time, they've all fallen off the bandwagon. They've all fallen off the agenda, and there's been no prioritisation within government with regards to this, and no action. That has to change. The other key feature to all of this is the extent to which our state, to an overwhelming extent, relies on the private sector. And when we say the private sector, we have to be careful here, because within the private sector there's a real mixed bag. Yes, 80% of care is within the private sector in nursing homes. But as my party leader said yesterday, Ivana Bacik, 10 funds now control 30% of nursing home beds. 38% of all beds are controlled by large long-term residential companies, and they are growing. And the reality is that in the 2000s, we saw the nursing home sector turbocharged by the tax exemptions brought in by a Fianna Fáil government starting in 1997 and continuing well into the 2000s. And now what we're seeing is that REITs are beginning to operate in the sector. So they are able to go in as propcos and buy up buildings or set up buildings, and then they have an opco to effectively operate. So there is a business model there that is designed to maximise profit, to separate out liabilities and exposure, particularly with regards to accountability, but ultimately putting our state and most crucially those individuals who are in those facilities, those elderly people in those facilities, in an extraordinarily vulnerable position. And we as a state have done little or nothing, and you as a government over the last 10 years have done little or nothing to ensure that there is increased scrutiny over those facilities. I was talking to a medical professional yesterday who has a long years of service in the nursing home sector, who has significant funds in the bank. And he went to the bank to try and borrow to purchase a small nursing home in the south of this country. He couldn't get a loan, and that nursing home is now in the hands of a conglomerate. And that is happening right across this country. There's nursing home providers, small nursing providers who do great work, many of them, not all, some mostly do great work, and they need to do upgrades to their nursing homes. And they're being refused funding. So then they find themselves in difficulty with HICWA, and then we see the closures that we have seen on the scale over the last number of years. I think 20% of nursing homes closed between 2020 and 2022. So, Minister, there's fundamental decisions for this government here about what type of nursing home sector you want in the future, and in particular to the small nursing home providers across this country. Do you want them or not? Because right now they're not getting support from the banks, and they're certainly not getting support from the state. And they would also hold a view that with regards to HICWA, that there's been kid gloves on the bigger operators and less so on those. Now, that has to be teased out over time, but it's certainly an allegation that they would make. But the reality is that we have a growing market-driven, profit-driven nursing home set of operators, and that has to change. And the key issue in all of this is the impact on care. Earlier today, I talked about the number of people who are now on minimum wage, the vast numbers in the private nursing home sector on the minimum wage, the incredible turnover figures, 54% in 2022 amongst healthcare assistants. Now, we're all talking about the turnover in the childcare sector and other sectors. I don't think that the 54% figure can be beaten across any other industry in this country. And there is a reason for that. Because of how they're treated, because of the lack of resources, because of all the things that we saw on that programme last Tuesday night. They're being deprived of resources, they're being made work extremely long hours, and they're being getting paid pittance. And the reality is that this government has report after report sitting there with regards to how we need to change pay if we're to improve quality. And I want to just quote to you this 2022 report. So your department put together a report on the Strategic Workforce Advisory Group on home carers and nursing home healthcare assistants, September 2022. And there are two really important recommendations. Number one, that all private sector and voluntary providers should be invited to give a commitment to pay home support workers and healthcare assistants at a minimum the national living wage. Now, your government has abandoned trying to, for all workers, to go next or near a living wage. But for healthcare assistants within nursing homes, what have you done? I don't think I've ever heard a reference from this government with regards to this. The reality is that the operations system need to be told that they need to put a joint labour committee in place in cooperation with trade unions representing workers and ensure that there are proper terms and conditions. And that is the second key recommendation, that there has to be an appropriate mechanism to reach agreement in respect of pay and pensions for the workers in the sector. Now, Ministers, within your power, it's within your gift to go and bring unions and those operators into the room and tell them that they need to agree better terms and conditions. And the second key issue is with regards to minimum staffing levels. The reality is that we've got minimum staffing levels in the north, we have it in other countries, they do not exist here. HICWA has no requirements with regards to staffing levels. So we can only imagine that for those operators that are purely profit driven, ensuring that there is sufficient staff in place is not a priority. It's not a priority when the bottom line is to make a greater buck. It's not a priority when ultimately there's a race to the bottom. And we're talking about our loved ones here, our older people, people very vulnerable, who need respect, care and dignity. We're not talking about looking after tins of tomatoes or something else. We're talking about real people here, and this is how the state has reacted by not putting down minimum staffing requirements. And the reality is that if we don't, we're going to continue to see these crises time and time again. The last thing I want to say here is that there has been a pattern from Lees Cross to the what was revealed with regards to the private nursing homes and how many of them fell apart during the pandemic, and to what we saw on our screens last week. That private nursing homes have not found themselves well equipped to be able to deal with situations when a crisis hits. And we have again reports from your department with recommendations as to how to better equip them into the future. And it's the state's role to do that. But crucially as well, the state has to take a leading role now. And so my question to you, Minister, before I finish, is are you comfortable with the level of private sector supply into our private sector provision of nursing home care in this country? Are you comfortable that we are entrusting the care of our loved ones, of our older people, the people who need respect and dignity in the state, to very large operators who, in many cases, whose sole motivation is profit? Are you comfortable that there are people being paid the national minimum wage looking after vulnerable people in this state? Because if you're not comfortable, then please, we need to see action. And this is not just about HICWA. This is not just about ensuring that we get the home care support scheme in place. This is about ensuring that you put legislative provisions in place. And I see that in the 2024 Health Miscellaneous Act last year, I think section 113B, and I can correct the record later, there is provision for the Minister to actually set out. You have the power to prescribe information to be furnished by nursing homes and other centres with regards to Chief Inspector, with regards to person employed and details of employment. Now that hasn't been, there's been no regulations in that respect. We need to see those regulations ASAP. Gurmagat.
Deputy Mark.
Gurmagat Cahirlock. Minister, we've been here before. It's 20 long years, as other members have said, since we saw the distressing footage of conditions at Lees Cross Nursing Home. Unfortunately, what we saw on the RTE Primetime Investigates programme replicated those horrific and indeed dark days. First of all, I want to thank Niamh Hegarty and the RTE Investigates programme, and of course the whistleblower Claire Doyle, for exposing these abuses. What we saw on the programmes aired was simply elder abuse. Older people manhandled, pushed around and heartbreakingly forgotten. It was tough watching for me, listening to a loved one calling out for help with nobody answering. I cannot but imagine how the families of these people who had effectively lost their dignity in these homes must have felt when they saw this programme. The lack of basic medical equipment such as hoists, wipes, gloves or even clean bed sheets was alarming, to say the least, because what we saw in these programmes was simply profiteers, more worried about profit, lining their pockets, than caring about basic human dignity. The joy of the staff rewarded with 4 packets of wipes from a manager is an unwanted highlight from this investigation. The lack of gloves and incontinence pads or clean sheets up there also, with the horrific treatment of our fellow human beings. Minister, as I said, this is all about the bottom line for these companies. How much profit these uncaring companies can milk out of our older and disabled population. Because, as has been said, 80% of Irish nursing homes are private or voluntary, and just 10 investment funds own 1/3 of all the beds in the system. An influx of investment funds in recent years has left our country with the most privatised system of care in the EU. As my party leader said yesterday, some things have changed since Lees Cross. HICWA was set up to set standards indeed, inspect and shut down non-compliant nursing homes, both public and private. But Minister, clearly HICWA is failing in its duty, and in my opinion, and the opinion of many, is now not fit for purpose. I listened to the family of Aidan Guy. I listened and watched their torment because, as so many families in their situation do, the first place they looked for a place to take care of their father was at the HICWA report for the nursing home. They were failed in this report, which painted a picture for them that was far from the reality that we all saw for their father in these programmes. And so many families have said to me since last week, families rely on information from HIQA. And the cases that we saw last week, unwittingly putting their relatives in harm's way. HIQA's practices must be urgently reviewed, but it is best practice to ask HIQA, or is it, Minister, best practice to ask HIQA to also conduct an independent review into all nursing homes? After all, it failed to identify glaring abusive practice that some journalists and a carer with a camera found, and of course they had the ambition to find those abuses. Of course, Minister, this would seem not to be an isolated incident. Since the first programme aired, I and other colleagues have had a growing number of complaints from family members from around the country. The simple fact from this profit-driven industry is that so many families tell me that the only contact that they receive from the nursing home is the letter demanding payment. Nothing about the care for their mother or father or a relation and what they're receiving. An area that you raised yourself and an area I want to raise tonight, Minister, are those families who look after their father or mother, their relation at home. Since the horrific programme aired last week, I've been contacted by a considerable number of people who take care of their loved ones in this way. They do so because they believe it's the best place for them, and many families are now looking to do likewise. However, as you said yourself, Minister, there's a serious cost with this, and government need to do more to help these families in this situation. Government should consider opening up a fair deal type system to families to provide care at home. They should look at making the housing adoption grants easier to obtain. Of course, abolishing, as has been said already, the means test for carers would allow a family member to receive some payment for the work that they carry out. I agree with the Taoiseach today, who said in response to my colleague Deputy Sherlock that we are over-dependent on private nursing homes in this country. We are seriously over-dependent, Minister. We need to invest more in public nursing homes. I use the opportunity to once again highlight the magnificent care provided by the staff and management of St Vincent's Hospital in my hometown of Athy.
Thanks, Deputy.
Thank you, Look, we are waiting on a new 92-bed hospital there, and I would welcome the progress to date. But that's the type of care facility that government need to invest in and the state needs to look to in the future. We need staff levels. We need properly paid staffs. We need to take care, as you said, Minister, of older people once and for all. We cannot let this continue again. Government,
Deputy Williard.
I am here today following the disturbing revelations uncovered by RT Investigates programme into the residents' nursing home in Portlaoise. We must be absolutely clear. What was exposed was not just failure in one private institution. It was a systemic failure, a failure of oversight, of communication and ultimately of duty. Frail and vulnerable old people were left in unacceptable conditions while warnings were ignored. Despite HIQA issuing poor reports over the past year, admissions continued to this facility. That raises immediate and serious questions. How many of these admissions came directly from local hospitals? Were local HSE managers, particularly community-based managers, aware of the severity of the situation? Why was there no communication between HIQA and the HSE? We must face difficult truth. It appears that the HSE has washed its hands of the responsibility of the clinical care of older people in private nursing homes. It appears that as soon as a person enters the private system, they vanish from the radar of our public health infrastructure. Minister, that must end. We need to reassert HSE responsibility for the clinical care of all our older people in long-term care. The long-term care needs of older people must be overseen by the doctors and nurses in the HSE regardless of where they reside. I want to be clear. This is not an attack on the hard-working local staff of whom I know personally well, many of them from Portlaoise working there. It is a call for structural change already recommended by the COVID advisory group. At a national policy level, there are several immediate steps that must be taken. We must redouble our efforts to provide robust clinical oversight of the private nursing homes by the HSE. Safeguarding legislation first proposed in 2017 must be enacted without further delay. If a company director provides presides over neglect, they must be held accountable, up to and including criminal liability where appropriate. The Safe Staffing Framework Phase 3, which sets out the minimum staffing levels and skill mixes of nursing homes, must be implemented. The care of vulnerable older people should never be left to the mercy of profit-driven motives. We must also, Minister, rethink of the infrastructure of residential care. Why are we still building massive institutional settings for older people when we have moved away from the model for people with disabilities or on mental health conditions? The Department of Health has been sitting on draft design guidelines for smaller, homely, community-based nursing homes. These guidelines must be adopted and they must be enforced. Minister, we must be honest about the consequences of continuing to favour large corporate homes. We must push for smaller community homes which can be viable with proper supports. We must accelerate the introduction of the home care legislation and rollout of the housing with support grants, which is a must and which is needed immediately. The choice between limited home help and institutional care is not good enough, and you know that, Minister. Older people deserve real options to live with dignity, independence and safety. I would just like to say that I'm a public representative in Portlaoise since 1979. When I was first elected, on my watch, we had the General Hospital in Portlaoise, we had St. Vincent's Hospital, we had Abbeyleix, we had Shane and we had Mountmellick. And we had Shane and Mountmellick and Abbeyleix for the people that I represented since 1979. And I have to say, never did I get a complaint. Never. Not once. And I think that, and I served on the local health committee, I served on the Laois Health Committee, I served on the Laois Offaly Health Committee, and I served on the Laois Offaly Longford Westmeath. And I always say it, and I'd say it if you're sitting where you're sitting today. The Taoiseach of this country did one of the greatest things. He banned smoking in public places. But the other worst thing he done, which was worse, he disbanded the health boards. I was a member of the health board when he disbanded it. Everyone of all political persuasions and none that were on the health board that day, everyone said it. That was the worst decision that was ever made. And what has happened ever since? Downward, downward, downward. Crisis after crisis. We have another crisis here today. And that's why I'm asking you to go back, exactly what you have said here today, relook, rethink, make sure that our older people are looked after. And there's things that we can do immediately. We can have a look at the home care packages, and we can do that with immediate effect. I know that 99% of the people that I've represented all my life always wanted to look after their parents in their own home.
Thank you, Deputy.
That's always the number first thing, and we can do that, and I'm pleading with you here today, Minister, to please act on this, and none of us here, none of us want to look or have to look at what we looked on the television the other night. And can I just say this for all your benefit?
You're finishing up, Deputy, thank you.
I know, I was there the day it opened. And when any would like to go to look at it, it's the most beautiful building, all decked out inside and everything. And did I ever think that I would come back and see and watch on television what was happening further up the corridors?
Thank you, Deputy. Deputy Butterley.
Thank you, Chair. Minister, there's no doubt everybody has come into the chamber and talked about the RT programme. As a daughter who had a father in residential care, as a sister who has a brother who's only 55 at the moment, who is in residential care with Lewy body syndrome, I actually couldn't watch the programme because, as many people who have the parents or a member of the family in residential care, very often we are overridden by guilt, because even when it is the best option for our loved ones, we often wonder, is that the best solution? Could we have done something more? Could we have got some more support at home? Could we have pulled an extra hour or two out of our day in order to help them stay in the home? So I actually avoided, when I missed it on the first evening, but I avoided watching it because I actually find it very difficult to go and visit my brother. But I had the opportunity this morning to listen to the son of that gentleman in the RTE programme, and he voiced so many concerns that I think myself, my family members and so many other people think about every day when you have a person in a nursing home, insofar as what was on the paperwork didn't match up to the actual care that was happening on a day-to-day basis. And it had me once again reflect, and I know we have spoken about it several times. As a councillor and as a TD, I'm passionate that we find a system to the equivalent of the Fair Deal system that allows our parents, our loved ones, to stay in their homes for as long as they possibly can, and hopefully till the end of their days. This is fundamental. The stats back it up, the facts back it up. The longer we can keep our loved ones in their home, the better they are for it. And we, as loved ones, are the better for it. They're healthier, they're more mobile, they're more stimulated. All the things that a family can give to a loved one is missing, no matter how good the nursing home is. So I would always urge that we find a system that keeps our loved ones in the home. I urge you to bring about, and I know you're working on a similar Fair Deal scheme for keeping people in the home. It can't be that difficult. And I'm a great believer, where there is a will, there is a way. And we can do it, and we have to do it. We can't be here again in a year or in 5 years talking about another RTE investigates, because this isn't the first time. And we know that during COVID, there were plenty of issues in nursing homes. In County Louth, you'll be well aware that in County Louth there were issues, and there are still questions to be answered. But we also have to take care in rural areas, particularly. I'm in County Louth, I come from rural areas. We have to find a Fair Deal scheme that is fair to farmers. We have to allow them to have a better accessibility to the actual scheme. But we also have to look at the carers, because very often the carers provide an invaluable service. They don't become a carer, they become a friend to the family, they become a friend to the person that they are taking care of. But unfortunately, if it's a bad road, a bad pothole, a laneway that these carers can't get up to because of the conditions of the road, an awful lot of these carers aren't paid appropriately. They don't get car allowances to do the mileage to go down country roads. And very often, simply because it takes them longer to get there and longer to get back, they actually don't want to come into the rural areas because they can do 3 or 4 calls in the space of the time that it takes to do 1 call in a rural area. So we really need to revisit what we are doing for the carers that have such a responsibility towards our loved ones. And I would ask you to review that as well, Minister. Thank you.
Thank you, Deputy. Deputy Burke, 5 minutes.
Thank you very much. Minister, I can go back over 21 years ago when my legal office and another legal office identified a major discrepancy where over 80% of people's pensions were being deducted in public nursing homes. And we identified that the health boards and the Department of Health didn't have legislative powers to do that. As a result of that challenge, over 450 million had to be refunded to 20,000 families. And that challenge subsequently led to the creation of the Fair Deal scheme. And the whole idea of the Fair Deal scheme was that everyone would be treated equally in relation to, number one, as regards the financial payment, and number two, as regards the care and support that they would receive. What we saw in prime time is not acceptable and must not be tolerated. All these are people who have worked, who've paid taxes, who've reared families, and this is not now the way to treat them in their final years. Management and owners have the prime responsibility, and what we saw here was not the necessary care and even the care supports that were required for individuals was not available and was being rationed. This is not acceptable practice. We all have a part to play in relation to the care of those who have gone before us in relation to the way they have built, and previous generations have built up this country and have contributed to our education system, to our local authorities, to all of the services that we enjoy. They all played a part in that, and it's important now that we give them their support when they need that support. And I think it's important that we look at the whole issue in relation to funding. For instance, you take, at the moment, 80% of people in nursing homes are in private nursing homes, but they only get 60% of the funding, whereas 20% are in public nursing homes, which get 40% of the funding. In fact, the figures are the public nursing home is over 1,900 per week, and the private nursing home, the figure actually is €1,969 per bed per week. In a public nursing home, private nursing home is 1,206. So public 1,969, private 1,206, difference of 763. And remember, as well as the cost of staff and all of the electricity costs that private nursing homes have to pay, they also are paying commercial rates to local authorities. They're also paying interest on loans that were taken out to build those nursing homes. So there's adequate costs that they have. And I think we've got to look at this as regards, if we want to have an adequate system, we must provide adequate funding, and we must make sure that the staff that are employed in the private nursing homes, that there's adequate number of staff, that they have adequate training, and that they have adequate communication skills, because it's so important as regards communicating to anyone who needs care, whether they're in a nursing home or whether they're in a hospital, and that they have time to listen to those people that they are caring for, because that is one of the things that older people want to make sure that they are being listened to. And I think it's important that we have with people with the necessary skills in relation to all of those people that they're caring for. It's also important that we need to make sure we've adequate review of their medical needs. That's not a case of prescribing the same thing month after month after month without a proper review. I think that's one of the things that we also make sure is happening in our nursing homes, and that there is the necessary support is provided. And it's interesting during COVID how we were able to develop supports. For instance, rather than transferring, it's an easy option for a nursing home to transfer someone into a hospital and take the burden off of the nursing home, where we set up teams from hospitals that would visit nursing homes, and as a result of, in one case, over 350 people who were in nursing homes, where there was a review by a medical team from the hospital, only 20 of the 350 had to be transferred into hospital. And we need to develop that, to give support to the nursing homes as well, to make sure that we have a proper and comprehensive healthcare being available in nursing homes, rather than transferring people into hospitals. And can I give you one last one? Is a case of a 97-year-old man being transferred to a hospital out of a nursing home, and he dies 4 hours later. I don't think that's acceptable. I think, the care should have been provided in the nursing home, and the supports need to be given to the nursing homes so that they can provide that care as well.
Thank you, Deputy. Back to Sinn Féin. Deputy Buckley, you have 5 minutes.
Thank you, Chair, and thank you, Minister, for your opening remarks. First of all, I just want to commend the whistleblowers on this. I keep saying it here on the record. You get absolutely battered for helping people and telling the truth in this country. Minister, the Irish population is ageing and growing, which is associated with higher levels of ill health and greater demand on all types of health and social care services. This obviously poses great challenges, but we in Sinn Féin believe that we should see improved health as an opportunity as well as a challenge, celebrating and enabling the contribution older people make to our communities while building a health service that cares for us as we age. In the words of the democratic programme of the first Dáil Éireann, we are committed to the care and support of Ireland's older people, and it quotes, who shall not be regarded as a burden, but rather entitled to the nation's gratitude and consideration, end quote. The footage shown on the Primetime Investigates programme on Amy's nursing homes was far from showing our older people gratitude and consideration. It was shocking, disturbing, and it was just nothing short of abuse. Too many elderly people in our country are living in facilities that are underfunded, understaffed and underregulated. When I saw the footage of a frail female resident with dementia, considered a serious fall risk, being left alone on the edge of her bed for 7 minutes at night while confused and agitated and seeking a toilet break, I thought of my own 79-year-old mother and how angry and let down I would feel if that had been her. Families are now lying awake at night wondering if their loved ones are safe, if there are basic needs, and are their basic needs being met, and if they are treated with the compassion and respect that they deserve. Families should be able to trust that facilities are meeting the standards that our elders deserve. Even with greatly enhanced home and community care for our older people, many families still have to make the difficult decision to place their loved one in a nursing home as they require full-time care. Given this, it is essential that people are supported in long-term residential care and that the highest standards are maintained. We need to ensure that they are safe, clean and dignified conditions maintained in all our nursing homes. We cannot continue to rely on HICWA alone. We in Sinn Féin have long called for the adult safeguarding legislation, mandatory reporting of abuse and a legal right of entry for social care teams to investigate complaints. The Primetime Investigate programme proves just how critical those reforms are to prevent neglect and abuse. We in Sinn Féin call on the Government to immediately enact the adult safeguarding legislation, as this would provide a legal framework to support safeguarding, additional powers for social workers and relevant social care professionals and the agencies separate from the HSE, which is empowered to oversee safeguarding policy and practices across the public and private sector and in the home. We need to legislate to provide a legal right of entry to any designated care centre for relevant social workers and social care professionals. Nursing home staff are overworked, they're underpaid, they're doing their best, but that's all they can do under impossible circumstances. They deserve better training, fair wages and the resources necessary to provide a high quality care. Currently, they are being left without the most basic items like bed sheets, towels, sanitary wipes and gloves. And to add insult to injury, families are facing high costs to pay for this long-term care. There has been next to no investment in public care homes. Over 70% of our homes capacity is now private. This was facilitated and enabled by the successive Fine Gael and Fianna Fáil governments, and this is the result. When profit is prioritised over people, it is our most vulnerable who pay the price. In this instance, it was our older generations. The privatisation of nursing home care cannot come at the expense of substandard quality and care. We need to tip the balance back in the favour of public capacity with robust regulations and the appropriate safeguarding protections. If we don't do this, in the words of Professor Robinson, David Robinson, a consultant geriatrician in St James's Hospital, and I quote again, he says, "This is going to shorten people's lives, and the lives that they have will be more miserable because of the situation they're in," end quote. So this, I suppose, is not a matter for tomorrow. This need is urgent, and the cost of inaction will be measured in human suffering. We owe our elders not only the respect but our action. The Government has a responsibility to protect the most vulnerable in our society, and I call on the Government today to make elder care a national priority, not next year, not after the next crisis, but now. God míle magat.
Thank you, Deputy. On to the Social Democrats. Deputy Rice, you have 5 minutes. Thank you.
Minister, the RT Investigates programme was shocking, disturbing and really difficult viewing. Nobody in this country should be treated in that way. It's really clear the nursing homes in question were understaffed, under-resourced, and the patients there were treated in an appalling manner. And what concerns me and concerns lots of us is that this is a repeat of scandals of the past. What we're seeing is history repeating itself. We saw Elise Cross 20 years ago, and deputies have set out previous scandals, and time again we have failure after failure. And I wonder what lessons have been learned And I have absolutely no doubt we will be back here again. We will be talking about another scandal because there's been a lack of action for decades on these issues. HIQA, which was set up in response to these costs, I think has serious questions to answer on the credibility of their inspection reports. We need to review the powers and the operation of HIQA. We need to review how the inspections take place and when they take place. And I think what was clear from that show is a lot of the issues are happening at night, and I have questions whether HIQA are going in at night and doing inspections at night. And I think that needs to be looked at. And also HIQA needs to look at the minimum staffing requirements and setting regulations and rules in place so that those nursing homes are well staffed and well resourced. But ultimately, we have an issue with the model of care. There are serious issues with this for-profit model of elder care. International research shows us that you've got worse outcomes when compared to public and not-for-profit models. And what we've had in Ireland over the last 35 years is an explosion of this for-profit nursing home care model. In 1990, 32% of nursing homes were private. By 2023, that was 81%. So there is a real shift, and these are policy decisions, they are government decisions, to shift away from public and not-for-profit model to a privatised model, which is leading to poorer outcomes for people. And what we've seen across the country is smaller, community-based nursing homes closing in village and town across the country. We now have 10 investment funds who hold a third of nursing home beds in the state. 10 big funds holding a huge amount of control over the nursing homes. In 2020, both Leo Varadkar and Simon Harris said that the model had to change. What has changed in the last 4 years? We now have the most privatised nursing home sector in all of Europe. There's long been calls for safeguarding legislation. There was a private member's bill introduced in the Senate in 2017. 8 years ago, there was calls for better protections for vulnerable adults. In the meantime, the Law Reform Commission has published a report. And what has happened? Absolutely nothing. There's been a failure on behalf of the government to legislate, to put basic protections in place and to protect the most vulnerable adults. The HSE has a safeguarding policy, but that does not apply to private nursing homes. HSE social workers do not have the right to enter private nursing homes. And it's an absolute scandal, and it needs to change. And Minister, you and your government have the power to make that change. You control the legislative agenda and have the power here to pass legislation, to pass safeguarding legislation. We have waited far too long. And there is report after report after report stacking up in your government department on adult safeguarding and on all of these other issues that needs to change. But ultimately, most older people want to remain in their own home, and we know that. Simon Harris, in 2017, said he would put it on a statutory footing, and it was incredibly frustrating to listen to Simon Harris in the Dáil this morning saying he's committed to putting the legislation on a statutory footing when he committed to that when he was the Minister for Health back in 2017. So what kind of commitment is it if it takes 8 years to do the very basics around home care? We need a right to home care, we need a regulation of home care, we need the funding of home care. But it seems to me that nothing is happening. And as a result, we have this privatisation of nursing home care and people being moved towards nursing home as a default because the home care system isn't properly regulated, resourced, and there isn't a rights-based approach, and it really needs to change. And we are constantly in this House talking about productivity and other parts of our state, but what we need more is more productivity in this Parliament. And we need legislation passed, we need a right to home care, we need safeguarding legislation. And I want to call on you, Minister, to give us a timeline for those. Give us commitments today on when those key pieces of legislation will be passed, because it's within your power, it's within the power of your government to make those fundamental changes that will have a real difference and will prevent these scandals from happening again.
Thank you, Deputy. Deputy Gibney, 3 minutes. Thank you.
Growing old is a privilege, and one that hopefully many of us in this chamber will be able to enjoy. And I think we have a lot to do in Ireland to deal with our attitudes towards ageing and the way we treasure and nurture our older population. We shouldn't infantilise them as we did during COVID. And mostly, and I think particularly when it comes to this issue around care, we need to offer choice. Because the reality is that we are all living longer healthier, and we are also facing into much more complex healthcare plans for people as we age because of those demographic realities. So for me, I think choice, public care and prevention are the three key elements that we need to focus on in this particular area. And when we talk about choice, what we're saying is that older people should be facilitated into their older years, and their families and communities should be facilitated to allow them to make the choices that they want to make in relation to their own health care. So if that means remaining at home, if it means living in facilitated environments or actual nursing homes, that spectrum of choice needs to be available to them. In terms of public care, I think it's just so sad that we are seeing this trend in so many areas towards privatisation. We've heard earlier about the trend with indirect provision that we saw. Instead of building those state care or state-run centres, that we've had this reliance on private facilities. But similarly in this area, the fact that we have so much reliance now on private providers, when actually this is something that we should be providing from the state. And that is the vision of sláinte care in terms of healthcare and the public system that we know we want to get to, that universal healthcare provision. And I think we're also missing a trick as a population here, and as a government, I think you're missing a trick. Because we talk a lot about automation and the displacement of labour that we're going to see through automation. And the one sector that you cannot automate is care. You can never provide for robots and machines to provide care. And yet, we continue to undervalue care in our society. And of course, it's mostly carried out by women, but I'm talking about care roles in nursing homes, I'm talking about voluntary care roles in communities and families, I'm talking about teaching roles. Those are all areas where if we actually placed more value in them, we could invest in our future, future-proof our labour force, and provide for that choice that we want to see. And finally, I want to talk about prevention, because I come from the human rights space where a lot of work goes into prevention. And in 2017, when I was director of the Irish Human Rights and Equality Commission, we were talking about the ratification of the Convention Against Torture and the implementation of a national preventive mechanism. We are still talking about that. Legislation has not been passed. And that is something that can provide for the preventative mechanisms which will make sure that this doesn't happen, because it goes beyond the HIQA remit. And I think HIQA is a fantastic organisation in a lot of ways. There's really, really good people there and good structures there, but they have been fighting constantly for additional remit to allow them to do their actual job. What the optional protocol for the Convention Against Torture and the National Preventive Mechanism would do, if it was properly implemented, would mean that this is prevented. It never actually happens. They have much better facilities for both unannounced and announced visits. They have the actual mechanisms located within each sector. So you would have the Inspector for Provisions for Justice, you would have HIQA for the healthcare and nursing home sector, but they would be beefed up in terms of the strengths and the powers that they have. That's the legislation we need. It's been there for a decade now nearly, and it's just not getting passed. So that's something I think you should be looking at as a department. What we need for older people is safety, security and certainty, and these are elements which can bring that about.
Thank you, Deputy. Deputy Hearn, 3 minutes. Thank you.
It's another scandal, another failure of our state to protect our most vulnerable. The failings of care that have been revealed in the RT Investigates programme were absolutely horrifying. Vulnerable residents left unsupervised, a lack of basic supplies and the rough handling of older people. One of those nursing homes is Benevan Manor, which is in my own constituency of Dublin North West. Members of the public across the constituency, and indeed across the country, who have families in nursing homes are distressed and worried. How can they trust that their loved ones are being cared for properly after seeing these failures? Paul Guy, whose father was one of the residents highlighted in the RT Primetime programme, reached out to me and I spoke to him today. Paul and his family have described the shock and distress at seeing footage of their 80-year-old father being roughly handled at the Benevan Manor in Glasnevin. Paul has said that no one should be handled like our father was. These are human people, people who lost their dignity, and no one should have to go through that. They had relied on HIQA reports on Benevan Manor for guidance in selecting the nursing home. The most recent publicly available HIQA inspection for Benevan Manor dates from November 2024. It references residents being happy, inspectors finding the centre well managed, and the quality and safety of the services provided being of a good standard. But clearly, as the RT Investigate programme showed, this was not the reality for elderly people, residents there like Paul's father. Shockingly, Paul told me today that no one from HIQA has been in touch directly with him to give him an apology for how his father was treated. He and his family have not been given the decency of an apology from HIQA and the state regarding their failures to protect his father and ensure he received adequate care and was protected from harm in a nursing home. Minister, will you and HIQA give him and his family the decency of an apology for the state's failure to safeguard his father? Minister, why does it take the airing of vulnerable adults being treated terribly on national television before we will see action on this? And the question is, will we see action on this? The key issue Paul asked me to raise was he wants to see immediate action from the government, as set out by Safeguarding Ireland, to implement the framework for adult safeguarding as published by the Law Reform Commission in April 2024, and to get the interagency working group up and running with an appropriately skilled senior civil servant seconded to it, and implement and get a national safeguarding authority. My question is, will you commit to Paul and the families affected to move immediately to implement this? Implementing this framework is the first step to ensuring residents in care homes are protected. Ultimately, they're not being treated with the care or dignity they deserve, and the government has a responsibility to ensure this does not happen again. We still do not ensure the delivery of care for our most vulnerable people in our society is done through a human rights approach, one that puts their dignity and the state's responsibility to guarantee their safety and protection central to service provision, whether it's children in state care, children in homelessness, or here adults in residents in nursing homes. This is just not good enough.
Deputy Farley, 3 minutes.
Thank you, Cathal. Minister, thank you for your opening remarks. Cathal, what has concerned me, I think, and many others since the publication of this damning and tragic show is that when we speak to those who are working in the sector, when we speak to families, what I consistently hear is that this is the tip of the iceberg, actually. And the fear that is out there within the sector and the staff and within families is, what don't we know? What's left to be found out about this? It is of real concern, Minister. You know that. You don't need me to tell you that. But when we have a broken policy and when we have a broken system, then we can't but expect to have a broken culture. And I think what the show has done is put a magnifying glass on a severely fractured elder care sector and system. And when we, as a state, allow our responsibility to be taken over by the private market, we run the gauntlet, because what happens is those who we entrust to care for our most vulnerable and who stand to make a significant profit from that will treat that as a commodity. So what do we ask of the government to do? We're not going to overturn an 80% private system overnight. So what is of incredible importance is that the robust policy and legislation is there so that elderly people won't be failed. Staff in the sector are adequately trained and resourced. And that when these situations arise, that the bodies we trust in the state to react have the teeth to do so with meaning. It starts by fixing the broken policy, the broken legislation, so that we hope to improve the culture and no longer fail those vulnerable people in our society. It's about dignity, it's about human rights, it's about our values. Thank you, Minister.
Thank you very much, Deputy. Back to the government. Deputy McAuliffe, you have 7.5 minutes. Thank you.
Minister, like many in the House, when I watched the programme last Monday, my heart was breaking. But Benevan nursing homes are literally 5 minutes from where I live. There are neighbours and friends who have relatives in Benevan nursing homes, and however difficult it was for any one of us to watch that programme. I cannot imagine how difficult it was, and I know many people, as was referenced earlier, couldn't bring themselves to watch that programme. But having watched the programme, I think there is one area that we have to call out very clearly, and that is those with direct responsibility for the neglect and direct responsibility for the lack of care. And that is, in the first part, those people who carried out those acts. When you are willing to close the door so your colleagues don't see that you're taking a shortcut, you know that is wrong. You're closing the door. When you're filling out forms that aren't correct, you know that's wrong. And it is not correct, it is not professional for you to do that. So there's a basic lack of decency and human compassion when that happens. Secondly, there's a basic lack of supervision and management here. When you don't have sufficient supplies in a nursing home of basic sheets and incontinence wear, that is a basic lack of management and of procurement. And those people who are responsible for that are directly responsible for that. And there was a basic absence of culture. A basic absence of, they say culture is the quickest form of management. Things can be acceptable and things can be unacceptable. And in organisations where culture is strong, things will be called out by your own work colleagues. Things will be called out without a manager having to be before you. And it was very clear that there was no ethos, there was no culture of care in these nursing homes. And I say that with huge regret, Minister, because I have been in these nursing homes and I've seen the people who've been cared. And I had thought that these places were good places for older people. Over the years, I would have got many requests for people to get into Beneva Nursing Home because it was seen as a premium nursing home, one that was accessible and local and where there was care. And that was because the HICWA reports were in many ways very positive. And for Beneva, unlike Portlaoise, for Beneva, the HICWA reports on reading were positive. And as a family who recently had a relative in nursing home care, HICWA reports are important to families when they're selecting a nursing home. So there were numbers of families that I spoke to this week, those who had relatives directly in the broadcast, and they were incredibly upset. Like, I can't tell you, Minister, how upset they were. There were families who were not featured in the broadcast and who felt that they had huge concern and worry and still have had very few answers. And there were relatives who felt they had a positive experience in the home. And I was very fearful, Minister, of re-traumatising those people or opening up the doubts of those people, particularly where many of those people, their relatives, might have passed away. But there were three people who I spoke to this week who did have concerns. A lady called Christine, who had a relative who was featured in the programme. A lady called Patricia, who had a relative who passed away, but who made a complaint to HICWA last year in relation to Beneva, and a lady called Phil. Now, each of them, Minister, I think touch on things that are broken in the system. This week, HICWA provided a briefing for the 3 TDs in our constituency, and it was a useful briefing as an insight. They did acknowledge additional powers and additional resources which were given to them last year. They did acknowledge that the inspection report was based on an unannounced inspection. With some reassurance, they announced that there had been 2 visits by 6 inspectors in the 3 Beneva nursing homes over the last week. But they have not yet contacted relatives, and I think that, Minister, is something that's really important. There's no trust in the provider anymore. There is no trust in the provider anymore. But HICWA needs to step in and explain what they explained to 3 local TDs this week, because we didn't get any particularly sensitive GDPR-related information, but we had contact and we had an opportunity to question. Families are entitled to that too, Minister. Now, they pointed out to a number of worrying concerns too. There appears to be no baseline staffing ratio, Minister, as there is in the acute setting. There's no baseline education or training. In a childcare setting, there is. Why is that not in place in a senior section? And also, they pointed out one area that I was alarmed at was that there's 3 separate legal entities that are on the Benevan site, all of them under EMES, but the holding company, which owns multiple legal entity providers, is not accountable to HICWA. Now, Minister, that is an area you have to be concerned with, particularly because as the number of these have grown, now we have large numbers of nursing homes under a single provider, and HICWA, we have to get around that issue. The final thing is the amount of money that's going into these homes. The Nursing Home Support Scheme, the Fair Deal Scheme, I believe was a positive way of reducing the huge burden that was on many families that they were paying. Families were paying thousands of euro, and the Fair Deal Scheme gave a way to prevent that. As a member of the Public Accounts Committee, there's a procurement issue here, Minister. We are procuring services from these providers. In Benevan alone, I understand millions of euro was going in every year. Somebody needs to stand over the delivery of that procurement. It's not about standards. Standards are important, HICWA is important. But I'm talking about if I'm the customer procuring the service, I should also be responsible for ensuring that that service is delivered. There should be an independent standards authority, absolutely. But the HSE or the Nursing Home Support Scheme, and in essence the government, are the ones that are procuring this service, and we have to make sure we're getting value for money. Look, I think back to all of those families, and I think the way we make this better, Minister, is by improving where we have. I disagree with some people in the House who say nothing has changed since Lee's Cross. Any basic assessment of the framework would say that's not true. We now have HICWA, as other people have said, that HICWA does much good work. The methodologies, I think, need to be examined. I think we need to talk more about the basic care. There needs to be a greater focus on that. But let's not run away from what happened here. Undercover camera went in where no inspector would ever see behaviour that was effectively being hidden. And those people, the people who are directly responsible for carrying out those services, the people who manage those services, the people who are paid to run those services are the ones with responsibility.
Deputy Mark Daly, and I'm afraid, Deputy, you won't have your full time. I'll be asking you to adjourn in the middle. Thank you.
Okay.
7 minutes.
It was, but the problem is that we have a cut-off point after 2 hours, Deputy.
I just need 5 minutes, okay? That's all right.
We'll do our best, thanks.
Thanks, Karen. Minister, like you and everyone in this House, I was deeply disturbed by the scenes broadcast in the recent RT Investigates programme. Whilst immediate and decisive action is required in those specific cases in Glasnevin and Portlaoise, and I fully support you and the Government's commitment to that, this must also be a catalyst for wider reflection. How are we going to care for a growing population of older people, many who will require some level of support to live with dignity and independence? Our population is ageing rapidly, and that is the mark of progress in public health, but it presents serious challenges. We must ensure that our care system is prepared not just for immediate pressures, but for the longer-term demands that will come with demographic change. Many of our older people are living longer, more healthy, independent and productive lives, and that's to be welcomed. But when their living needs change, it must not be a binary choice of home or a nursing home. It is my belief there are people in nursing homes today who would be better served by sheltered or superintendent living in the community. It is essential we get the regulatory framework right. I welcome you've met the Chief Inspector of HICWA and that he plans to appear before the Health Committee shortly. I also welcome your commitment to progressing safeguarding legislation whilst recognising existing protective legislation, policies and protocols. While regulation is vital, it is only one part of the solution. Culture within care organisations is equally important, and it is culture that ultimately determines the quality of care experienced by patients. We know that culture comes from the top down. What we saw in those recent reports was not simply individual misconduct, although such behaviour is inexcusable, but the product of a deeply unhealthy organisational culture where management is driven primarily by profit and staff are clearly undervalued, undermanaged and deprived of the most basic tools to do their job. In such an environment, it is inevitable that standards would degrade, staff would become demoralised, demotivated and disconnected. And culture is more difficult to measure, but we're going to have to find a way to do that. And we're also going to have to find a way to sanction those private companies financially who do not manage those nursing homes properly. As a GP who's worked closely with more than 10 nursing homes over the past 3 decades. Excellent small community-based homes such as Nightingale in Ahaskra, Oakwood in Roscommon, St Francis in Kilkerran and Montbellew Nursing Home. I've seen the difference that a positive personal culture can make. Older people living in their communities in those nursing homes, often with contemporaries they know and cared for staff they also know. Unfortunately, many of these smaller homes are now struggling to remain viable. I'm told it takes a congregation of 70 in a nursing home to make it profitable for private operators. In my own area, 2 excellent homes closed, Ballygar Nursing Home and Brideswell Nursing Home in Athlone. My own grandmother lived for 2 years and died in Ballygar Nursing Home. She was given excellent care, and one of the most natural things in the world was that my children would wander in to visit and chat to her on the way home from school over those 2 years. And we've become too reliant on large corporate congregated settings where that sense of community and personal connection is lost. Now, I know you and the government are committed to increase the provision of public nursing home places, most especially in the area of people who are living with dementia and Alzheimer's. However, we must look beyond institution models. We need to build a continuum of care that enables older people to live in their homes and communities for as long as possible. We must also use smart technology to enable them to do so. Nursing home care should be the last resort, not the default option. That means being more ambitious about innovative care models, such as retirement villages, where independence is preserved and intermediate levels of support are provided. It also means addressing the current barriers to home care. Too often where home care packages are approved, they cannot be delivered due to workforce shortages. We must look seriously at the terms and conditions for home care workers and invest to make this a sustainable, respected career pathway. I would also urge we examine closely the comparative costs of long-term institutional care with community-based and home care. In many cases, keeping a person at home is better for their well-being and more cost-effective for the state. Minister, the older people we are speaking about today have contributed immensely to the life of this country. The least we owe them is a system of care that honours their dignity, respects their humanity and allows them to live with purpose and autonomy for as long as possible. I support the direction the government is taking, but I also believe we must think more boldly and build a modern model of care that truly meets the needs of a changing Ireland.
Thank you, Deputy Daly. I'd ask you to move the adjournment on this debate. Thank you, Deputy. So moved. Minister, I'm afraid now we adjourn this debate to future.